is a balance class, okay? My job is to help you, if you want to call it, I talked to someone earlier about being uncomfortable to get comfortable. By getting uncomfortable, meaning that we have to train our brain and our mind to work together so we don't fall. So we have a stronger body, so we have better balance. I'm going to walk through, I walk with my patients, how to get there from someone that has, for example, I had someone, Renee, a retired sheriff officer, and he has problems with back pain, neck pain, neuropathy down the legs to the feet, where he, because of all that pain he's had for a long period of time, especially being one-legged, has caused a lot of balance issues where even though he exercises, sometimes he will lose his balance. Getting out of bed, for example, getting out of a chair. So my job was, again, to make things want to improve over time, get things to stay better and get better. Okay? So what I do when I talk about being uncomfortable, I want you to understand that our brain only responds to change when it's stimulated. By making someone feel like they're off balance when I'm working with their balance, helps them actually get their brain to reset because now they're interested. They've been turned on per se. If we get this brain to turn on, by getting your body to actually learn how to regain balance slowly if you've lost balance, or if you have good balance, how to maintain that over time. Okay? Someone in, come on, I like your outfit.
Thank you.
You're ready for Halloween, man. All right? So what I'm going to do, I start very simply. This is for someone that, for example, not Renee I talked about a second ago, but a patient I've had before, William or Bill, where he was in a walker. He went from a walker to a cane to walking on his own because he had bad balance, he had weakness in his back. His body had learned to do this, right? When we have weak and we have bad balance, what do? We don't stand here, we stand here. Or we stand with the walker like this. You got to get the body to come back here first. This is my reset for everyone too. You stand up with better posture and position. Okay, so when I do that, what I'll do with someone, take my shoes off here, so I'm going to show you some feet work to start working your balance too in a minute. Even if you can't do that standing yet. We want to start always with good posture. Okay, that's what I always focus on in all my classes, I think all my classes, is standing back here against the wall with your heels, hips, shoulder, and head. And you may only be here, but is that better than where you were before? I had someone come this morning, he's only in his 40s, but he's had a bad back for a long time, so his posture is almost like this. Getting back to here is almost impossible for him. But can we start wherever he is, go back just a little bit more, and over time a little bit more, a little bit more. Once your body's in a good posture position over time, if we can get to wherever that is, then our posture, we can start moving in this better position. If I'm moving here in this position here, I'm just going to reinforce this posture, this balance position. Okay, does that make sense? If we have better posture, our balance gets better faster. Okay? So wherever you feel comfortable, maybe here, wherever it is on the wall for you, when I reset someone's posture, what I tell them to do, because I start off with a new patient today, I have put their heels against the wall, hips, shoulders, and head. So wherever you feel comfortable, we want to make this your normal over time. If they're standing, say with a walker, or even just freely without a cane or anything, I want them to feel like they're back on their heels, a little bit more than they're used to, so they're uncomfortable, right? If I'm uncomfortable, I can cause a change. So I want to feel like my body's here instead of being here. More on my heels if I can. Okay? So to start, once we have a good standing posture, whatever that might be for you, where you're a little uncomfortable, then what you do is focus on your overall feet. Okay? So I'm going to start here on the chair first to kind of show you what I mean by that. Is I want you to do is focus on here. You can see it easier here. You want me on the mat or no? Is it easier to see it on the floor? It's up to you guys. What do you think? On the floor or on the mat? What's easier to see? Can you see this okay?
On the floor.
Cool. Okay. So here, what you do is practice is if you have shoes on or not, is putting one foot on your heel and one foot on your toes. Okay? Anyone dance here? Do any dancing? Fantastic. Okay, good. When we're dancing, I had someone come this morning too, saying that a new patient, she does ballroom dancing as a way to, if you want to call it, stay healthy. So a lot of hers is balance oriented, so she came in because of her balance issue. So we focus on with her, is how do we go from here where we are right now, so if I'm on my toe on one, heel on the other, I'm going to switch them back and forth. It's going to rock my feet. Okay? So it's not doing this. It's just rocking back and forth so you feel the whole shoe or feet at home want to move and roll those feet. Okay, just rolling your feet. Okay, we're doing it at home, we're sitting down. It is a little bit difficult sometimes to kind of focus on, okay, how do my feet roll? I want to go back and forth. Okay? I'm doing it at home on the floor, for example, or on a mat. Now going to your feet, your tactile sensation in your feet to fire those nerves to your brain. And which part of your brain controls your coordination and balance, you think? Anybody know? This part, yes.
That was a guess.
It's good guess. I pointed there a second ago. Good job, paying attention. It's called your cerebellum. Okay, that calls your coordination and balance. If you have problems with that, you may have some issues with the coordination. Okay? So when you roll your feet, you get those nerves to fire from your feet, through your legs, through your spinal cord to your brain, to make your body, okay, what am I doing there? What's going on? Okay, once you've done this a while, you feel pretty comfortable, okay, maybe 30 seconds or so at home, and you can do is using the wall to make sure you don't fall, because I hate for you to fall and come back next month and go, I broke my hip. I'm like, that's not good. It's not causing injuries here. Okay? So take it easy. We want to use the wall to hold our balance. And now, same thing, roll your feet. So all I would do is put one foot in front of the other, like you're going to walk, and just roll your feet back and forth. You just feel that position move. So now you're adding your body weight, your load on your feet to add more sensation. Okay? Any questions about that? You want to allow your body to slowly move and smoothly move. When I say smooth, because I have some people that come in, they've had a hip problem, they've had hip surgery, they've had problems with a knee or a foot. So what happens over time, they start stomping instead of stepping. Does that make sense? Oh, I told her name's Betty. Tell her, I don't want to hear you walk in. When you hear walk in, I'm hearing this. I'm like, no more of that. We're going to do this now. We're going to come here and roll our feet. I was teaching her probably about a month ago. Start rolling her feet. Because when you have an injury, you naturally want to support that other leg. Okay? Once you have an injury, we don't realize we're doing it. So I'm going to tell her, I don't want to hear your feet, because I want to hear you practicing at home, rolling your feet through time. And one side, when you do this, may feel more comfortable than the other one. You go like, this doesn't feel right. I'm not left-footed. All right. So you got to figure out what's going to work for you. You want to work the weakest one more. Why do you think that is? Why do you want to work your weak side?
To build it up.
Good. You want to build up that, not only the position and coordination and motion, but that nerve flow from your feet to your brain. That's why I look with the feet first, because that allows you to now maintain a better position once your feet are in a good position. Okay? Any questions about that? So my feet are working well. Am I going to be more here or more back here? I'm going to feel comfortable here. Now my feet are working. Now I can stay back here more on my heels than on my toes when I'm standing, or when I'm walking, or moving around, or exercising. Okay? Even if I'm going backwards, I'm still going to feel I can hold my balance, because now my body's working better. With physical therapy, for example, a lot of work with is ankle strength and movement. By doing this exercise with load, either sitting or standing, allows the ankles to move more and build up those muscle ligaments around the ankles, even tendons. So you may feel when you do this, you may feel a little front shins, or heel anterior front of your leg, or calf tightness, or even just where it feels a little achy. Okay, why do you think that is?
You're working it.
You're working it, and because when you move your foot, there's not a lot of muscles in the feet. All the muscles, what they do is come down from the calf or the front of the leg. They form a tendon that comes into the foot. So even though you're moving the foot and the ankle, the muscles are actually in your lower leg. So you want to feel them work more to make those muscles get stronger, to hold your better balanced position, and again, prevent falling. Okay, any questions so far? Nothing yet? Simple stuff, right? Okay, so sitting and standing. Next one we want to do now is using the wall again for balance. What you want to do is slowly, as your foot's stationary, is bring just one leg up, hold for a second, and bring that leg down. And then switch sides. Okay, you want to bring your leg up, if you can, where your knee is horizontal with your hip. So you're here, not just here. Worthless. We're just doing this. You want to go as high as you can, where you're comfortable, because when we're doing bringing your leg up, it's almost a high knee on the wall. Here, what are you working? Which muscles do you think you're working? You're doing that. When you're bringing your knee up. You're actually using the hip, the lower back exactly, and this hip to hold your position. Because what I don't want to see when I have someone do this is do this. Okay? Because then you have a weak side hip that helps your muscles coordinate when you're walking. When we walk forward here, now we don't have our hips sway out to each side. That's not cool right now in 2021. All right? Any questions about that? TFL bend can get tight, okay, with this exercise. If I'm doing this enough, coming up, hold, relax, bring that left foot down. Other knee comes up, horizontal to the hip, hold, relax. These will get tighter. Is that a good thing?
Yep.
Yes. Tighter is stronger. Tighter is better balance. Tighter is going to allow you to walk and move further, longer distances, so you have the endurance to move. You don't get tired and start doing this again. Either dragging your feet or stomping like my patient Betty does. Okay? Any questions about that? I'd recommend, if I was seeing you, maybe 10 foot rolls, okay, each side at home, at least once a day, and then maybe 5 on each side of the raised knees on the wall, facing the wall. Okay? Once you've done these enough, what I'm going to have you do is turn around if you're my patient, and now focus on this knee raise here, but now with your back against the wall. Okay, the reason is, what do you think the reason is I want you against the wall? Better balance, better posture, boom, standing, boom, all of it. Okay, we're going to be here now, and the reason I want the knee coming up if possible to the hip level, because when we're walking, we're just doing this little bit of motion here and there. We're going to have 4 range of motion. I want the whole muscle to work, so at that point, our whole body's working. When I'm here too, now I have to really use this hip more, along with my glute, along with my overall hip, to maintain this position so my hip doesn't move. I don't want to do this. See you later. Okay? So if you need to, you can use a chair, but watch your head on the TV because you might hit your head. Just slowly against the wall, with your back against the wall. Now, do that knee lift here and just hold that position for a second and relax. Bring that foot flat. Give yourself a second to breathe. And then I don't mind if your feet are off the wall, but you want to make sure your hips and your shoulders are against the wall along with your head. Okay? If we're going to move a body part, we can keep the other body part still, so we're getting the brain relearns where your body needs to be position-wise, not just our feet back here. Okay? Always think about, if I'm going to work out, patient work out, go, your first rule of thumb is your posture. I don't care if you do cardio, you do weights, I want your body back here. You want to learn this position, not reinforce this position here. Okay, so I'm going to start here again. I'm just going to call it a knee lift on the wall, or facing off the wall, or on your back on the wall. Come straight up, hold. I'm putting a little bit of pressure on the chair so I don't move. Hold right there, and then switch sides. Foot goes flat, give yourself a second to rebalance back to more even. Once you're bouncing even on both feet, then switch sides, come up, come back down. Is it okay to go side to side a little bit? Yeah. We have to balance our foot here on that hip. We're now putting all our weight here on this side. If I bring my left leg up, but I'll bounce my right hip, my right leg, and I come back over here. Is my head, am I looking at the floor or am I looking straight ahead?
Straight ahead.
Straight ahead, right? Okay, I want to use my feet, my legs to hold my balance position, not my eyes. Okay? When I have a patient, she does one who does dance this morning. He walks up Euclid every day. Go, when you walk up Euclid, how do you walk? Like this? My Chihuahua. I go, I look you up Chihuahua, but can we get the body back here? So if I'm going to work out, I want the body walking and moving here, up here, against the wall, Again, 5 each side. Hold that leg up, horizontal to the knee. At that point, drop this way with your head up. So now your lower body's holding your balance instead of your vision controlling your balance. Any questions about that? Questions yet? Is this going to make you tired? Probably. Is it going to make you feel a little like worn out? Maybe. Is it going to improve your balance? Yes. How long will it take, you think? 1 day, 2 days, 3 days? Maybe a few weeks. A few weeks. Once you have better balance, then can you walk, stand, sit, get out of a chair easier? Yes. Not fall? Yes. Not use your health insurance as much? Yes. Okay? So once you've gone through now a knee lift with your back on the wall, facing away from the wall, with your head up, now we're going to start walking. Okay? Once you have these things down, so what I'm doing is helping you work the smaller muscles first, hips, and also the feet, so that allow your body to handle more load of your body being back here in a good position posture versus leaning forward. Okay? Next one. Move this chair out of the way a little bit. This slides pretty well, actually. Okay? Yes?
Does this also affect your thigh right here?
Exactly. Actually, exactly. Yeah. So allows now your muscles here to your side, attention fasciolata. I call it side of the hip. At that point, that makes it work harder, right? If I'm bringing this leg up, my right leg up, my left leg has to hold my balance so I don't fall over. It almost pushes, if I lift my right leg, pushes my body to the weight center of gravity here instead of popping it out. So when someone has tight hips, I go, how do you walk? If that does feel tight with that exercise, cross your ankle over your knee. And what you do is bring that, so I'm crossing my right ankle over my left knee. Now as you stand up straight again, hint, hint, as always we're about posture. I'm going to bring that knee, that right knee to my left shoulder, as much as you're comfortable, to stretch out that glute and that right hip. Because again, that hip you're talking about attaches to your glute, attaches to your back, attaches to your leg. If we keep the hip loose, and that side muscle loose, side hip loose, then everything else stays strong and loose too. It's all connected. If someone has, for example, a hip problem, I always go, think about the joint, not just the hip, but also one joint below, one joint above. I want to work those whole areas. Okay? So that muscle, again, I'm going to bring that knee up to my opposite shoulder. So I'm working my right leg, it's going to be my left shoulder. Hold that for about 10-15 seconds or so. And then switch sides. Okay, again, left ankle over the right knee. And everyone's going to have a tighter side, right? We're not, our sides, left and right side, one will be tighter, one will be weaker. This side's tighter for me. That means this side will make my left lower back weaker too. So a tight muscle is a weaker muscle. You got to keep them loose to make them strong, then you'll have better balance. Okay? So again, I'm going to cross my left leg over my right knee. That one, the left ankle is over my right knee, and bring that left knee to my right shoulder. Hold that position for 15-20 seconds, and then that point, let that release. Maybe once or twice, not very often, because you're holding it longer than just a quick stretch. You want to maybe twice. You want to give yourself a number. Fantastic. It hurts. Fantastic. Keep doing it. Keep doing it. Whenever someone says that hurts, when I, for example, I see a new patient, and after I adjust them, I treat them and all the stuff I do, I always show them a couple stretches. And when they stretch, I'm like, that stretch, I'll push, till I see their face change, till I see them squint. Like, when they go, oh, I'm like, that's where we want to stretch. That's where we want to go, because when we go there where you feel a little or uncomfortable, or you squint with that stretch, then you cause the muscle to actually physiologically change and stretch out the muscle. You're causing body change.
So why does the joint hurt?
Because that's what the muscle attaches to. So your ischial tuberosity, along with your hamstring, attaches, your ATB band, along with your hamstring, attaches to your ischial tuberosity on the bone itself. So it makes that face, like just like that. That's the face you're looking for.
I thought I was getting in shape, but it hurts.
No, you are getting in shape. So now, once you have these stretches down, we worked on the hips, worked on the ankles, and also posture. Now we're going to work on walking. Okay, when I have people walk, I want them to walk with their head up the whole time. I want them to walk with their hand on the wall, just one hand on the wall, just to kind of learn your balance slowly. The wall should not move on you, correct? So if you're going to fall, I hope not. These walls are pretty good. They built, good architect here, I think. At that point, what we're going to do is if we're going to fall, we're going to fall into the wall, not away from the wall. Again, I want to get a phone call next month. Yeah, sorry, Sally didn't make it. She broke her hip. Do your stretches. That would not be good for me. Make me feel bad. Okay? So what we're going to do, we're going to walk, what we did a second ago, like we did, we're going to walk with heel to toe. So we're going to go here. So I'm going to start with my left foot down. What I want to do is roll my feet when I actually walk. So I'm going to do left heel down so people can hear it. Left heel down, bring up, and then flat my left foot as I bring my right foot up on my toe. Hold it for a second, and then switch. Bring my right foot forward, hold for a second, and flatten my right foot. Okay? Why is it good to hold when you're walking, or when you're training your walking? Why is it good to hold that position for a second?
For stability.
Helps your balance, helps your stability, helps your muscles stay strong. I can do this all day long, right? Boom, 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 boom. But if I'm stopping, I'm having to really think, okay, where's my head straight? Where's my foot going to land? Heel first. Let that foot roll. My left foot roll flat. Bring my right toe up at the same time. So now I'm working on the small motions of my ankle, my feet. My muscles here holding me from going side to side so my body stays upright here instead of falling forward. So we want to make sure when we're slowing things down, we're working on more balance and more strength. So you can do this. I can walk from here to the end of the mat in about 1 second. Okay? If I go slower, then I'm going to work more muscles and really work on those muscles getting stronger to hold my body up in better balance, better position. Okay, so again, just reiterate. Right, that takes probably about 2 or 3 steps so they get it. So we do left side first, left hand on the wall. Walking this way, left heel down. Wait a second. At that point, drop that left foot flat, bring the right toe up. So you're up on your toes. Now switch feet. Hold for a second. Drop the right foot flat. Left heel comes up on your toes to your left foot, and do one more step. Okay? Once you've done this one way, now we're going to switch sides and go back this way. Why do you think that is? Why do you want to go both ways?
Balance out.
We all have a stronger, weaker side. If I'm working this way, I'm working almost my right side of my brain and my left, my right side of my brain, left side of my body. You want to do both sides to make sure both sides are even. Even though our hips are off a little bit, yes. Our body's off a little bit, we're all made differently, we're all going to be off a little bit. If we train things even, as close as possible, so it doesn't throw off our body. Okay, so I'm doing the same thing. I'm going to face the right side using my right arm on the wall. And I'm going to start with this time with my right foot. Bring my right foot up. Let my heel drop to the floor. Flatten up my right foot. As I bring up my left toes up. Then switch sides. Okay, left foot comes over. On my left heel, drop my left foot flat. Bring that right toes up at the same time. Head up, body up at the same time. And keep going forward about 2 or 3 steps. Any questions about that? Seems simple. Easy to do, right? Okay. Now, can we do the same thing with your eyes closed? Whoa, crazy, right? Okay. Why would you want to close your eyes to retrain your balance? What do you think? What do you think? Why would that be important to do? What do you think? What do you think? Well, exactly. And we want, by not using your eyes as much for balance, now your body really has to figure out where it wants to go. You're really going to test everything and here in your physical body, instead of using your vision, using a stationary object to focus on where you need to be. even though my head's up, I can still see down toward my nose where the floor should be. I can still see side to side. My eyes closed, my hands still on the wall to give me some support. I call it my security blanket. At that point, I'm able to now close my eyes and now focus on my feet moving slowly, heel with my eyes closed, left heel, and then flatten my left foot as my right foot comes up on my toes, and switch sides all the way through. Nice and slow. Be with me, it feels a little off balance to where at that point I have to really focus on getting the body more level. Okay, same thing as you switch sides. My right side is the stronger side, that's just my side. Okay, so here, up, drop that left foot, come down, bring the right toe up at the same time. Your hand glide against the wall. And you may feel like there's more pressure on one side too. Alright, so realize as you do that, okay, I have more pressure, so I have to really focus on that toe dropping. Hold for a second, regain my posture, my balance, and then start over. My balance back again, and then come back one more time. Any questions about that? You guys tired of looking at me? How come I'm tired of my legs are cramping up? So, and as we do this, take a break. Get tired, take a break. I'd rather take a break than now start doing this. Or I'm just tired of doing this again. Okay? So take a break, so make sure your posture's up, work on each position at one time, and then that will get stronger. As we get stronger, then we can hold this longer when we walk, when we stand, when we go shopping, whatever we're going to do. We stay here instead of going back here. Any questions about that? So we've done eyes open, eyes closed. What else could we make it more difficult for our body?
Without touching the wall.
Without touching the wall, good. And what else? What else could we do? That's an easy one, right? But if I don't touch the wall, good. I can go here. I would still touch the wall a little bit though, just for safety reasons. Again, I want the phone call. And you're just one finger instead of a whole hand. Just so you're just here, you go, okay, I'm going to work on my balance. I'm going to get my eyes closed. Here, take a step. Here, take a step. Here, take a step. And slow it down if need be. Okay? But I also want to try doing it going backwards. So going backwards first with your eyes open. Okay? So here we're going to reverse everything. And I'm not very coordinated, so give me a second to think about what I'm going to do. Okay? We're going to go here. We're going to bring our right foot back first. We're going to start reversing it. I'm going to bring my right foot back, and when we bring my right foot back, I'm going to end up on my toes, right toes. Let my right foot drop backwards. As I bring my left foot up on my left heel. I'm going to switch feet as my head stays straight the whole time. Bring my left foot back. My left toes, let my left foot drop as I bring my right foot up on my heel. And then keep working backwards. Slowly. Take a second in between steps to regain your balance and reset that posture. Okay, and again, same thing. You always want to do both sides. Any questions about that?
It occurred to us, to me, that some of us may not have very many safe walls or safe floor areas.
So if you need to use even a table, that wouldn't be bad either. If you want to put a couple of chairs together next to each other too, depends on your height also, a couple of chairs together, and kind of let that go back and forth per chair, and do what you got to do. You know, I don't recommend using something that's going to move like a cane, because at that point it may throw your whole balance off. So just be careful what you're going to do. Yes.
You know, Jessica, your kitchen counter might be enough to, you know, pretty much
Well, I
everything.
have a long kitchen.
Well,
So you
that
like
sounds
a
ideal.
counter or a table too, you can have that table. Use that to balance it out. Just depends what you want to use. Be creative, unlike me. Very abstract. Just me. Okay, so next one is now we've done it with eyes closed, eyes open, right? We've done it even we've gone backwards with our eyes open. Now we go backwards here. Now with our eyes closed, same thing. So my eyes are open. Once you progress to that point, now close your eyes, hands on the wall, and walk backwards with your eyes closed. Take a step, drop that foot, bring that other heel up, and then switch feet. Drop that. For my sense right now, I'm on my left toes. My right foot's flat, and it's now switch backwards a little bit more. Drop my left foot flat. Go up on my right heel. Even with that, just throws me off a little bit. At that point, switch sides again. Drop the right foot on the left heel, and keep going back and forth. Again, 3-4 steps is enough to go, okay, whew, I'm tired here and here. The same thing, everything's tired. So reset everything all the time and maybe work on it every other day. If you want your posture here, you want better balance, let's focus on this first, being upright, using a wall again if you need to, reset your posture, then work on everything we just talked about. So when we work on it enough, maybe over a 3-4 week period, you can realize, hey, I don't even think about it anymore. I can take a step here, 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 my head's up the whole time, I'm not leaning down so much. But it takes work, it takes work, it takes work to feel uncomfortable, to make your body looser and stronger, than have better balance. All right. Any questions at all? Nothing yet? If you really want to test your balance so you can, I'll use these two, move that over a little bit. Once you're comfortable, I did this with, I think, Primo a couple years ago here. He was pretty good at it. Is take a chair, something that's not going to move, pretty heavy, okay? And now work on some lunges too. Let me check the camera real quick. We did this, I think, last time or time before that also. Yeah, we're good right there. We're going to do, use that chair. You want to put like a towel if you need, you can too. So I'll simulate that with my mat cover. You. And as you keep your head up, now we're going to put a lot of weight on that right hip. Okay, what I mean by that, when I drop down to this knee, let me see what's going to go. It's going to go here, right? We'll go back first. Okay? So I'm going to come down here. A back lunge, in most people, is easier than a front lunge. So I'm going to come here, using a mat or whatever you want to use. I'm going to go here, and as I'm going to do, I'm going to drop my foot down and my knee on that pad. I'm going to hold for a second. I'm going to come back up here. Any questions about that? I see the smile. Yes.
It's harder than it looks.
It is.
You make it look really easily.
So using a chair, you can do is add more weight to that chair with your left hand, if my chair's on the left hand side, and let my body come down slowly, hold for a second, and then come back up. To really get those muscles to fire on both sides. Same thing, we'll switch over here. For a back lunge on my left leg, left knee going down, come down, hold for a second, and then come back up.
Okay.
Yes?
What if you had a knee replacement and you can't get on your knees?
Then don't do this exercise. It's going to be painful. You can do, though, as an adaptation to this, instead of doing a lunge, a full floor lunge, is do a step up. So here, I would take, let me do this. Here, and not even holding a chair, maybe holding the wall, and just step up, hold for a second, and step down. In between, switch sides, step up on the chair, and step down. When you're doing this, it allows your hips to really fire, so at that point, hold it for a second, and rebalance and come back down. Switch. When you come back down, make sure we're coming back down. We're coming back down, putting both weight evenly on both feet first, and then switch legs. Again, we're slowing everything down to make both sides work evenly. When we're doing this too, with our feet coming like the wall, high knees, same thing, we're causing the hips to shift. We're trying to keep the hips as even as possible. Okay? So we're letting all the weight, all the shift occur here, not in the back end, which we want to do this. We want to keep our body straight the whole time. All right, so we do this. I would probably do this instead of the floor if you have any issue. We're not going to the floor. We want to make sure over time, if we can, if it's possible, I like some of the floor work, especially some of my seniors, that allows them to feel more comfortable coming off the floor too. If I'm here and then when I get stuck here, right, you know what do I do? I can't call, I don't have life alert. It's too expensive, I think, at least for us people under 65, like myself. At that point, I'm going to use my hands here and push myself up off the floor. We have to have good lower body strength to do that. So can all this get you there? Yes, it just takes time to build up the strength. All right. Who wants to try any of these? Let's try this. Anybody? Anybody want to try this? Nobody? Come on. Great soul. Get stuck. Great soul. Tell me your name again. Gwen? Nice to meet you again. So I'll do this first for you. Let's go here. And just the wall one, we're going to come here. We're going to bring our left heel down first. We're gonna come forward. We're gonna switch with our head up and go. So try on the wall over here. Try on the wall first. There we go. That's why we work on this. Good. So right there, left heel up, hold, head up, let that foot drop. Good. And then switch sides. Good. Right heel down. Hold that foot. Good. Oh, look at this. You're a pro already. Switch sides. Where do you feel that when you do it?
Here.
Good. In the hips, right?
Yep.
We have to make the hips stronger. When you guys stronger this way, go ahead.
Okay. Start with the right or left?
I'll start with your right.
I think this is the right.
Yeah, I think so too. Pretty good. Let that roll. Perfect. And then here, come all the way down. Stop. And now go.
Okay.
There we go. And make sure you roll good. Stop. Stop. Yep. And then roll. Yep. Exactly. That makes the brain really fire. The start and stop really makes the brain want to fire that cerebellum to fire up. Good, good, good. You got it. Okay. Now let's face the wall. Face the wall. And now put your hands here. And when you're here, bring your right hip up, bring your right knee up. Hold that for a second. Where do you feel that pressure? Perfect. Good. Switch sides. Where do you feel that?
Same.
Perfect. And we work these muscles out more. So I would do about 5 of these before you do the wall walking on both sides. Then turn around for me. Let's try this too. And move your feet off the wall a little bit. Hips, shoulders head against the wall. Bring your right leg up.
Which one's right?
Let's do this. Let's do this. Chair over here. Pull on the chair. Right leg up. More. Right there. Good. Hold for a second. And bring that down. Where do you feel that?
Seems like it's over here.
Perfect, because you're having to hold your balance with your left hip, the opposite side. Switch sides, left leg up. Good, hold for a second. And let the leg come down. Where do you feel that one? Good. It's the whole leg's going to fire on this side too. Okay, so same thing, let's do the right side one more time. I get confused all the time. Hold it right there, don't move. Good, now let it drop. Good. The other side too. Good. Let that drop. Good. How'd that feel, okay?
Yep.
You feel where that's going to need to work all these getting stronger. Because you're holding your body back here now, you may even have little back soreness. Congratulations. I'm hoping for it. Make job scary for me. It's right there. Good job, Glenn. Any questions at all?
Good job, man.
You have homework to do, people. Okay? Homework to make your body stronger and better balanced. It's not to be comfortable. Even right now, even though I had a good workout this morning, I'm a little tight, a little sore in my hips. Okay? I'm going to go home and stretch, go back to my house and stretch a little before I see some people this afternoon. But realize it's going to make things a little sore. So if you have that soreness in your hips, we talked about a second ago, make sure you go back to that stretch, the figure 4 stretch, where you bring that ankle over the knee, and bring that other leg you're working on, that right knee, up to your left shoulder. Get that whole hip to stretch afterwards, when too. I'll do probably before and after you do your stretching to make everything want to stretch first, and afterwards because you're going to be a little bit more tighter afterwards too. All right, so both sides again. Boom, boom, boom. Hold for 15-20 seconds. Keep all those hips loose. Any questions at all?
Well, I know some people are here because of their backs, and you originally started with your backs. And some people weren't here in the beginning.
Got it. Okay.
But how does this relate to some of the things you were sharing about
Good.
your back?
So we're working the back by keeping the body up and straight. By being here, by leaning forward, by leaning more back on your heels when we're standing, we're doing positions, allows now the back muscles to work more in a better posture position. These muscles in your back, you have